Hello, my name is Hui-Ting. My topic today will be lumbar disc herniation. Lumbar herniated disc is one of the most common spinal diseases that lead to mild and severe pain in the lower back. So in this video, we're going to talk about the description, patho, diagnosis, outcome, and treatment. Do you feel pain in your lower back? Do you experience numbness or tingling in your body? Maybe you suffer from the disc herniation. So here we're going to talk about the background, definition, and epidemiology. Lower back pain is very common and become more common when people is aging. It is very costly in terms of health care payment, disability payment, and missed work. For the group over 40 years age, disc herniation was found in 90% of those population. Herniated disc, also called a slip disc or ruptured disc, is the result of a tear in the outer layer of the disc, which acts as a cushion for the spine. The symptoms including electric shock pain due to the nerve pressure, tingling and numbness. Nerve irritation could interrupt your brain signals, cause some muscle weakness. Some bowel or bladder problem can also occur, which indicate the cauda equina syndrome. That is a medical emergency, and you have to see the doctor immediately. The interesting thing is about 90% of people who experience a lumbar herniated disc will have no symptom after 6 weeks, even if they have no medical treatment. Experts believe the symptoms from the lumbar disc herniation may resolve themselves for 3 reasons. The first is the body attacked the herniation as a foreign material, shrinking the size of the herniated material and reducing the amount of inflammation. Maybe over time, some of the water from inside of the disc is absorbed into the body, causing the disc to shrink. The smaller disc is less likely to extend into the nerve root, causing irritation. Also, lumbar extension exercise may move the herniated area away from the spinal disc. Whether exercise can accomplish this is a matter of debate in the medical community. The common cause of herniated disc including spinal wear and tear. The movements such as twisting, walking, and bending over time can get the disc worn out. So jobs that require heavy lifting and other physical labor have been linked to a greater risk of developing a lumbar herniated disc. The injuries such as the car accident can lead to a herniated disc as well. Smoking limits blood flow to the spinal disc, which speed up disc degeneration, making it more likely to tear or crack. Excess weight makes one more likely to experience a lumbar disc herniation and 12 times more likely to have the same disc herniation again, called recurrent disc herniation. Family history is also associated with an increased risk for herniation. One extensive study found out that a family history of a lumbar herniated disc is the best predictor of a future herniation. Men have roughly twice the risk for lumbar herniation disc compared with women. The incidence of the herniated disc is about 5 to 20 cases per 1,000 adults annually and is most common in people in their 30s to their 50s, with a male to female ratio of 2 to 1. In 95% of the lumbar disc herniation, the L4 to L5 and L5 to S1 disc are affected. Lumbar disc herniation occurs 15 times more than cervical disc herniation and is an important cause of lower back pain. The spinal disc in children have a high water content, which helps the disc stay flexible as they act as a cushion between the vertebrae. So fortunately, after age 50, the interior of the disc begins to harden, making herniation less likely. For the patho, the following video I found in YouTube can better explain the pathophysiology of lumbar disc herniation?
Your spine is composed of individual bones called vertebrae. Your vertebrae form a protective tunnel called the spinal canal, which surrounds the spinal cord as it travels down the length of your spine. On each side of the spinal cord, spinal nerves exit the spinal canal through small bony channels called neural foramina. Your lumbar spine is the lower third of your spinal column. Between each vertebra, a flexible pad, called an intervertebral disc, acts as a shock absorber for your spine. Lumbar disc pressure can increase by more than 50% when you change from a standing position to bending over, or by more than 80% between a standing position and sitting with no back support. The intervertebral disc's tough outer ring is known as the annulus fibrosus. The soft, gel-like center is called the nucleus pulposus. During a traumatic injury, your spine may lurch forward forcefully, causing your vertebrae to compress the front of one or more of your lumbar discs beyond normal limits. As a result, the back of your disc protrudes backward, causing small tears and thinning of your annulus fibrosus. Over time, your damaged annulus fibrosus may weaken and change shape, and your nucleus pulposus may dry out and lose flexibility. As your intervertebral disc deteriorates, your nucleus pulposus may push your annulus outward, resulting in a disc bulge.
There are 4 types of lumbar disc herniation, depends on how severe the protrusion is. The first is bulging, which means extension of the disc margin beyond the margins of the adjacent vertebral end plate. Protrusion means the posterior longitudinal ligament to remain intact, but the nuclear pulposus impinges on the annulus fibrosus. Extrusion means the nuclear material emerges through the annular fibers, but the posterior longitudinal ligament remains intact. The last one is sequestration, means the nuclear material emerges through the annular fibers and the posterior longitudinal ligament is disrupted. A portion of the nuclear pulposus has been protruded into the epidural spaces. So for the diagnosis test, including the questions, physical exams, nerve test, and image test. The question such as when and how the patient started, the pain, if there was any type of traumatic injury, any other medical conditions such as osteoporosis, for instance, increase the risk of fracture, if the patient having a physically demanding job or any other physical medical history. The physical exam included detailed neurological examination, such as loss of sensation, numbness, weakness in the leg and foot. The patient may be asked to work normally and on tiptoes to check for the condition called foot job. Muscle strength and reflex are also likely to be checked. The range of motion task maybe ask the patient to lean forward and backward and bend from side to side. Leg raising task is one of the most common stretch to test for herniation. For the test, the patient lie down flat on the back and the doctor gently raises the affected leg until the pain is felt. If pain occurs when the leg is raised at 30 to 70 degree angle, it's considered a sign of lumbar disc herniation. Gait monitoring will observe whether the patient appeared to be walking slowly due to the pain or with abnormal gait. Imaging tests may be included at the initial visit to rule out other possible causes of the patient's symptom, such as fracture, tumor, infection, or cauda equina syndrome. MRI usually provide the most accurate assessment of the lumbar spinal area, showing where herniation had occurred and which nerves are affected. Often, an MRI scan is ordered to aid surgical planning as well. CT scan is more likely to be used if there is a reason that an MRI is not advised. CT myelogram, using contract dyes in the spinal fluid with X-rays to view the dye. This can show both the size and location of the herniation, but is invasive. X-ray mainly used to rule out problems such as broken bones, bone abnormalities, infections, tumor, or problem with the alignment of the spine. X-ray are not typically used on their own to diagnose a herniated disc. Nerve tests including electromyogram and nerve conduction studies, which measures how where electrical impulses are moving along the nerve tissue. This can help pinpoint location of the nerve damage. Nerve conduction study measure the electrical nerve impulses and functions in the muscle and nerves through the electrode placed on the skin. This study measures the electrical impulses in the nerve signals when a small current passes through the nerve. During the electromyography, the doctor might insert a needle electrode through the skin into the various muscles. The test evaluates the electrical activities of the muscle when they contract and when they're at rest. If the disc herniation is symptomatic, different outcomes measure can be used. The first one is 36-item short-form survey. Is often used as the measure of a person or population's quality of life, which comprise 36 self-reported questions, cover 8 domains of the health, such as limitation of the physical activity, social activity, and etc. Oswestry Disability Index is another way for the doctor to measure how the pain affects their daily activity. Roland-Murray Disability Index is another questionnaire that a patient can mark and check how much score they get in order to decide if they have the disability or not. Visual analog scale, including the pain scale or meter-shaped scale, can also measure the pain of the herniated disc. McGill Pain Questionnaire is another questionnaire that the doctor can use to measure the severity and location and the feeling of the pain in the lower back. Treatment and therapies including medications, physical therapy, surgery, and additional therapies. Over-the-counter pain medications such as acetaminophen, ibuprofen, or naproxen are commonly used to relieve the pain. If the pain doesn't improve with oral medication, a corticosteroid can be injected into the area around the spinal nerves. Muscle relaxant can be used to help relieve the pain and muscle spasm as well. Sedation and dizziness are common side effects. If other medication doesn't relieve the pain, the doctor might order the opioid such as codeine and Percocet, which can be used in short term to help relieve the pain. Physical therapy programs are often recommended for the treatment of pain and the restoration of functional and neurological deficits associated with the symptomatic disc herniation. A microdiscectomy or discectomy is generally considered the golden standard for removing the herniated portion of the disc that is pressing on the nerve. Small incisions are used in microdiscectomy. Surgery is usually performed on an outpatient basis or with one overnight stay in a hospital. The surgery has a very high rate of success. One study reported good or excellent result for 84% of those having a microdiscectomy. Additional therapies, including ice application, heat therapy, chiropractic, acupuncture, and massage, can also be used to relieve the pain. Here are the ICD-10 coding related to lumbar disc herniation for the purpose of reimbursement. Lastly, here are my reference. Thank you for watching. Hope this video can help refresh your knowledge of lumbar disc herniation, and you guys have a good day. Thank you.